Hello, my name is Anaya Webb, and this is my Week 8 final return to demonstration video over a head-to-toe assessment. For this video, I do not have a patient, so I will just be using myself and just explaining the steps that will be occurring during this demonstration. To start off, I will start off with AIDed by introducing myself to the patient and letting the patient know that I will be their student nurse for the day and that I will be completing a head-to-toe assessment, and this assessment should take no more than 10 to 15 minutes. I would thank the patient ahead of time for being a participant and cooperating as I am completing my assessment. I would make sure that I would perform hand hygiene. I would provide privacy by shutting the door or pulling the curtain, and I would identify my patient by 2 patient identifiers, which would be my patient's name and their birthday. I can have them verbalize that to me, and I can make sure that I match that information up with their wristband and the information that is in the computer to make sure that I have the correct patient. I will also assess my patient for any known allergies, and I would assess their pain level, and I would have my patient rate their pain level on a scale of 0 to 10, 0 being no pain and 10 being the worst. After I have done that, I will go ahead and assess my patient's skin and nails. So I will start off by inspecting my patient's skin, and I am looking for any signs of lesions, wounds, or incisions upon my patient's skin. I'm looking at my patient's skin color, and I will note that their skin color is appropriate to their race, and their skin color is even toned throughout. Next, I will go ahead and inspect my patient's nails. So when I'm inspecting my patient's nails, I'm looking for any signs of clubbing, and I am inspecting the color of their nails. So as I'm looking at my patient's nails, I will note that their nail bed is pink. Their nails appear to be clean and smooth. There are no signs of clubbing. After that, I will move on to assess my patient's capillary refill. And to assess capillary refill, I would just lightly just press down on my patient's nails. And as I'm pressing down on my patient's nails, their capillary refill should return in less than 2 seconds, and that should note that they have no abnormal findings within their capillary refill. After that, I would move on to palpating my patient's skin. So with palpating my patient's skin, I want to use the dorsal sides of my hands, and I would just lightly just kind of rub my hands down their arms or down their legs, and I'm assessing for my patient's skin temperature. And if there are no abnormal findings with that, I would note that my patient's skin is warm and dry. After I have inspected my patient's skin and nails, I would move on to my patient's head and face. So I would start off by inspecting my patient's head, and I'm looking at my patient's head, and I will note if there are no abnormal findings. I will note that my patient's head is normocephalic. I will move on to palpating my patient's head, and I would just do kind of like a light palpation over their scalp, and I would note that there are no signs of lesions or infestations, and there should be no signs of pain or tenderness upon palpation. After that, I would move on to assessing 3 cranial nerves that are associated with the head and the face. So the first cranial nerve that I will assess will be cranial nerve 5, and I will be assessing for my patient's motor and sensory function of cranial nerve 5. So to assess my patient's motor function of cranial nerve 5, I will have my patient demonstrate a chewing motion, or I can have them kind of like chew a piece of gum or a piece of candy, and this just assesses that my patient has full motor function of their mouth, and there should be no signs of resistance or pain. And if there are no abnormal findings with that, I will note that the motor function for cranial nerve 5 is intact. For my sensory function of cranial nerve 5, I will test my patient's ability to feel for touch or pain, and I can do this 2 different ways. I can use a cotton ball, or I could use like a paper clip or a safety pin. I'm gonna go ahead and use the example of a cotton ball. So I can just take a cotton ball, I'll just say this is my cotton ball, and I will have my patient close their eyes, and I will take the cotton ball and just lightly just whisper it across their face, across both sides of their cheek and their chin. And I would just basically have them to either point to where I have placed the cotton ball or say where I have placed the cotton ball to assess that their sensory function is intact in cranial nerve 5. and they should be able to do that with no hesitation, or they should be able to feel the sensation of, you know, a soft or a sharp touch or feel. The next cranial nerve that I will assess will be cranial nerve 7. And for this cranial nerve, I will be assessing the motor function, and for that, I will assess my patient's ability to make certain facial expressions. So for instance, I have my patient make like a sad face, happy face, or a mad face, and if they're able to do that with no resistance and there are no abnormal findings with that, I will note that cranial nerve 7 is intact. Next, I will assess cranial nerve 11, and for that, I am assessing my patient's ability to rotate their head bilaterally, and I'm assessing their shoulder movement. So for that, I can have my patient do a movement as far as like moving their shoulders up and down, or I can have them kind of inversion or eversion of their shoulders, and I can have them rotate their head. I can either have them turn their head to the right, to the left. I can have them put their head up, have it move it down. And if they're able to do that with no signs of resistance or pain, I will note that cranial nerve 11 is intact. After I am done inspecting my patient's head and face, I would move on to inspecting my patient's eyes. So first I would start off, I'm just gonna grab my pen light. So first I would start off by inspecting the external ocular part of my patient's eyes. So as I'm looking and inspecting my patient's eyes, I'm looking for any signs of